Welcome to Radio SOCESP. Today we are very privileged to have Professor Hartley Wilson, the president of the American College of Cardiology, giving a wonderful opening lecture. And of course, the governor of ACC, Dr. Chagas, well known from all the Brazilians and the members of the SOCESP Society. And I would like to first ask you a question, Hartley. First of all, I forgot to introduce myself, Alex Abizide, from INCOR, HCOR, and CIRIO. My first question to you, Hartley, I was very interested in your lecture regarding artificial intelligence. And for the first time, I saw a very interesting and novel term, which is collaborative intelligence. Some physicians would be a little bit concerned and afraid of losing a little bit of their activities with artificial intelligence. Is that concept really to threat the physicians or to help the physicians?
I really think it's to help the physicians, and that's part of the reason we brought that out. It's not actually my original term. It is something that American College of Cardiology has, through our innovation section, decided would be a great way to bring this out, just as you say, so that perhaps it makes physicians a little more comfortable with this train that's coming down the tracks, and we know it's going to happen, and we need to know how to deal with it. And as you said, it's collaborative intelligence, which means that there has to be a superior thought from physicians who can actually make those decisions that are so important, as well as they interpret that for studies for their patients and so forth, moving on. So AI, artificial intelligence, augmented intelligence, it can bring us a tremendous amount of data, as we know. And then it can actually even collate that data and maybe even give us some statistics and so forth. But the collaborative intelligence part is that we need to interact with it and know what's important, as well as verify it, and then know how to use it.
Chagas.
Yes. First of all, it's a privilege to be with you, Alex, and also with Professor Hartley, our president for the American College of Cardiology. You talk about the collaborative intelligence, but I also wanted to talk about a collaborative work of the college around the world. You are president for the college, and as everybody knows, we are now in the 5 continents, and we have more than 44 chapters around the world. And you are very internationally in terms of the projects of the college. Tell us what the college can do for the world in terms of collaborative work.
Oh, it's a great question. I really appreciate that, Dr. Chagas. And you have also been very important, as you're now not only the governor of the chapter for Brazil and the American College of Cardiology, but you are also the chair of the Assembly of International Governors, which is the 42 chapters that you described throughout the world in the 5 continents. And so, yes, our program really, more than 10 years ago, has been one of trying to be a world organization. And now, with 56,000 members, about 20,000 are those that reside outside the U.S. We really think that we're starting to achieve that, and we want to continue to grow that. In fact, we're looking now as part of our strategic plan for this year for really international acceleration. And by that, we want to have ways that we are including our cardiovascular teammates around the world and starting to grow that, so that we can collaborate to fight this growing burden of cardiovascular disease. As we talked about and mentioned in the meeting this morning, the burden of disease has doubled since 2000. Now over 500 million people affected with cardiovascular diseases, and a growing burden of mortality, almost 20 million per year that are dying of cardiovascular disease. So, and all that is accelerating. So we have to find a way to collaborate worldwide to really try and bring this back down where we can start to really reasonably, get this under control. Now, we've also been to the UN and the World Health because, they have their Sustainable Development goal of trying to reduce cardiovascular disease by 1/3 by 2030. Very noble goal. Even if we get halfway there, I think that will be a great achievement. But all these organizations like SOCESP and the Society of Brazilian SPC, the Society of Brazilian Cardiology, ACC, AHA, ESC, I think we can all come together. We are, I think, starting to talk more and collaborate more to try and really work on programs like the Global Heart Attack Treatment Initiative, like Stent Save for Life. We're thinking about coming together on these programs because we're all on the same team trying to fight cardiovascular disease worldwide.
Wonderful. And in the same context of this potential collaboration, you gave also an amazing talk on cardiogenic shock. And you talked about the shock team, which is amazingly important to decrease mortality. How can we collaborate and contribute, and most importantly, train the physicians and hospital regarding this malignant situation?
Yes, I think this is also an exciting area of innovation and teamwork. And as you brought out, the shock team, which is really something that came out of the heart team, which we know was the first collaboration between cardiologists and surgeons. As we tried to decide what were the best therapies for our patients that had coronary artery disease, be that surgery or PCI or combination or hybrid or whatever. And so now we're seeing that because of the successes there and where they were actually able to show reduced risk by using a heart team approach, now we're starting to see this in other areas, as I showed you in the shock team approach. Even though we haven't actually shown the therapies or the mechanical support itself in randomized trials has reduced mortality, just using a shock team to look at best therapies and who to treat and so forth has really been very helpful. So I think as we move forward, this heart team approach, shared decision making, all of this, which we as well as your society support, I think are going to give better outcomes and also give better patient satisfaction.
This was wonderful. I would like to thank your participation. And again, your presence here means a lot to us. It's a great privilege, and thank you so much for all the collaboration. And for us, the future is very bright between our society and ACC. Thank you so much.
Thank you, Alex, and thank you, Antonio. And I would say we are honored and privileged to be here, and that's why we want to make a special effort to continue to be at each other's meetings and to continue to learn from each other and continue to collaborate as we try and do what we're here to do.
Thank you very much. Thanks so much.